in their care. So as you are doing the course, health and social care level 3, let's assume that you are all carers, okay? Let's assume that you are carers. So what are the things has to be done as a carer to protect the individuals in their care? The individuals are the people you are caring for. Yeah, the people you are caring for. Okay, I have some few points here. So a practitioner can safeguard individual by making sure that they are safe, they are in safe environment, away from abuse or harm. Yeah. So you as a carer, you have to ensure that the individuals or the people you are taking care of are safe in their environment. They are safe from abuse. They can safeguard individuals, making sure that they have DBS. All right, let me explain more of the first one. So you have to ensure that the individual that you are taking care of is safe. Maybe if the environment is not conducive, yeah, like if the what is it, Mr. A's room doesn't if there is maybe what is it, there is faulty equipment in the room, it has to be the faulty equipment, it has to report it to the right personality to ensure that the faulty appliances is fixed. Okay, there has to be enough air in the room. Yeah, the environment has to be safe so that the safetyness of Mr. A or Mr. B will be guaranteed. Is that right? Abuse is also not tolerated in health and social care. You can't abuse a service user. Yeah, you cannot abuse a service user. It's against the law for you to abuse a service user. Abuse are in different forms, like physical abuse, mental abuse, social abuse, institutional abuse, and all that. You don't have to abuse any social, health and social any individual that you are taking care of. Okay, and then to ensure their safety, to whoever is employed in health and social care environment has to have DBS. Yeah, you have to have a DBS to ensure that you can work with children or vulnerable people. Is that right? And
Yes.
then providing good quality care and support, putting individual in the center of everything. So the individual has to be at the center of their own care, meaning that it's all about the individual. The care provided is all about the individual. Yeah. It means that the wishes and preferences and needs of the individuals has to be met. It's not about you, but it's about the individual. If the individual wants to go out, that is his wishes, then you can tell that let him or her go out. Yeah, if maybe it's sunny, yeah, it's sunny in London at the moment, and if Mrs. A or Miss Smith, let's take Miss Smith, is in a care home and he wants to go out just to have some fresh air, and he tells you, oh, Nyano or Sharon, can you please take me out to have some fresh air outside for about 5 minutes? It's about the needs of the individual, okay? So you have to just tell whoever is in charge, maybe the manager or the coordinator, senior coordinator or whoever, you tell him, oh, Mr. Smith wants to go out, so I want to take him out for fresh air. So every need is centered around the individual, okay? You have to meet the needs, the preferences, and the wishes of the individual. The second point is empowering them to have as much control over their lives as possible. Yeah? To empower someone is to give the person opportunity to interact with you, okay? So you as a carer, the individual has to have the opportunity to interact with you, to tell you what he or she needs, okay, or the care that he wanted. Is that right? Yeah.
Yes.
All right. And employees should need to read their workplace policies and procedures for safety garden, which will provide information for which will provide information for steps to follow in reporting concerns or abuse. So there has to be policies and procedures in place of work, yeah, so that it will help employees to ensure that the safetyness of the individual is um covered. Okay, every work has their own policies and procedures in place, and it's your responsibility as a carer to know the policies and procedures to ensure that it is used or implemented in favor of the service user. Is that right? Yeah.
Yes.
The next point, it's a good practice to have a designated safeguarding led in health and social care. This is often the manager. So there has to be one person to be designated, yeah, to be designated to ensure that the safetyness of for safeguarding, to ensure that the safetyness of the individual is concerned. Yeah. All right. So some of the example of the policies for example of the organizational policies and procedures are safeguarding. Yeah. Can someone tell me what safeguarding is? Safeguarding. Yes. Nyano, can you tell me what safeguarding is? I'm on you today because you were present.
Okay. Safeguarding is it's ensuring that you protect the dignity and the well-being of your client.
Yeah. All right. So you ensure that you protect the dignity and the well-being of the clients. Yeah. The dignity and the well-being of the client. So you have to respect the client. You don't have to talk to them anyhow. Mm? For instance, if you are going to um to give personal care to a client, you can't just walk into the door without knocking. Yeah. First of all, you have to knock to let the person know that you are coming in and wait for response. Then when you go, you introduce yourself. Oh, good morning, Mrs. Brown. I'm so so and so. I'm Shireen. I'm Anno. I'm Al. I'm Ho Sam. Yeah, I'm Swibo. I'm here to give you personal care. I'm here to check and change your part for you. Okay, so make sure you always communicate with the individual. Yeah, ensure that you treat them in a dignified way. When you are giving personal care, to ensure that the door is closed. If the windows are open, you have to draw the curtains. Okay, draw the curtains so that nobody can peep through to see what is going on. That is an example of giving dignified care. Okay, you have to ensure that is always practiced. Okay, so can someone tell me what confidentiality is? Confidentiality. All right, confidentiality is ensuring that information about the service individual doesn't go out, yeah, but it stay in the workplace. Information about the individual has to be kept in a drawer and locked, yeah, and it has to be given to the right professionals when needed. Okay, and then complaints. Whenever you see someone abusing, whenever you see a staff member abusing a service user, you have to ensure that you complain. Yeah, that is whistleblow. You have to whistleblow. Ensure that any abuse that you see has to be whistleblow. Any abuse that you see has to be known. Okay, if you don't do it, it will go on and on and on and on, and you never know when it will hurt someone. Yeah, all right. So another one is also data protection policy. So there is data protection policy, which is the DPP. What is it? It's a policy, data protection. It's a policy. So it's a kind of policy that ensures that the data of the individual doesn't go out. It's like it's in similarity with confidentiality as well. So the data of the individual, like the age, the date of birth, the history, and any information about the individual doesn't go out. Okay, is that right? All right. Let's talk about importance of providing dignified care. Any question so far? Any questions so far? All right, let's move on. So, the importance of providing dignified care, first of all, is to treat individual with care and dignity. Yeah, the individuals have to be treated in respect and dignity at all times, giving them choices and involving them in the care and making sure that they are treated equally. Okay? All right. Another point is to ensure that you give independence to the individual. Make sure that the individual is given independence. Independence in the sense that some of them can do things for themselves. So if somebody can dress up when you wash him or her, ensure that after washing, you give the dress to the person to wear. But if the person cannot do things for him or herself, then you can step in and help and do things for him. But if he or she can do things for himself, just assist the person, yeah, or allow the person to do things for themselves. Yeah. All right. Any questions so far?
No.
Any question?
My volume had went mute, so I had logged out and I just signed back in, so I might have missed what was being said in the last few moments.
You were mute, sorry?
My volume, I couldn't hear anything in my speakers, so I had to restart. So
you
I'm
couldn't
back
hear
on again.
anything. Oh, I've touched a lot of stuff,
A
so
lot
I
of
can't go
information.
back because
The
it
last
will
thing,
waste the others' time.
the last part of the conversation, we were discussing safety in the workplace and the manner in which workplace, the employer is held responsible and accountable for employee safety. And then afterwards, it went mute. I've tried pressing all things to get the volume back up. Then I decided to just restart to get back onto the conversation.
One moment, please. Please, one moment. Yes, what did you say? Yeah,
Hi,
L.
yes, I was saying that the last conversation,
Yes.
last part of the conversation lecture that would have been heard clearly was at the point of discussing workplace safety, where you were making reference to the employer having the accountability and responsibility for employee safety. Then right after that, the volume went down. I couldn't hear anything. So I tried to see what would have been the problem. And the only way of solving it was restarting. So I'm back on now.
You said, did I mention the safety, the work safety, you mean the safetiness of the individual?
Yes, that's the last thing you were discussing. And you said all our employers must be held accountable for individuals' workplace safety and so on. Then you asked if anyone else have any question. And
Yes.
right after that, I could
Okay.
not respond because then the volume went straight out. I couldn't hear nothing.
Okay, so
whatever you would have said after that.
In a nutshell, in the summary of it is that the individual has to be safe in the environment that they are in. Yeah.
Yes.
Like if there is any faulty equipment, it has to be reported to the right channel so that it will be fixed. If the room has to be airy, if there is maybe somebody's pour some slipped water or something fluid on the floor, there has to be that yellow sign. The yellow sign has to be put there to ensure that the individual, yeah, doesn't slip, doesn't step on the maybe the water or the fluid and slip. Yeah, so it's all about the safetyness of the individual. And then DBS has to be anyone who wants to work in a care home has to have a DBS, yeah, to ensure that the person is not an abuser. The person can work with the vulnerable adults and the vulnerable like adults and children. Okay, and the individual has to be treated equally as well. There has to be equality and diversity in the care environment. So everyone deserves to be treated equally, regardless of their age, their background, their religious beliefs, their their religious belief, their age, gender, their sexual orientation, and anything, regardless of their background, they all deserve to be treated equally, race or whatever. Okay, all right.
Yes, I understand that. Yes.
All right. So how to assess the need of individual and joint care planning with individuals and family. All right, let's go on. So care planning with individuals and family. How to assess needs of individuals and joint care planning with individuals and family. So these are the points of how to assess needs of individuals and joint care planning with individuals and family. So first of all is to maximize independence and opportunity for every person living in the care home. Yeah, so there has to be opportunity for every carer living in the care home, opportunity to be part of everything, to be part of activities that happens in the care home. Okay. Another point is to understand and support individual identity and sense of self-worth. The third point is to respect people's choices. Yeah, we all have different choices. So the individual choices has to be met. Okay, maybe it's there is an activity going on. social activity going on in the care home, and all the service users have to take place. But Mrs. Smith is maybe not feeling well, and she said, oh, Nyano, today I can't be part of you, or AL, I can't be part of you. You have to respect the choices of the individual, okay? And then person-centered of the individual has to be ensured as well. And then having individual assessments and planning in partnership with the residents and their family. So during care planning, there has to be, during care plan, there has to be the family of the individual has to be taken into consideration, as well as the carer. Yeah, the family can be involved in planning of the care that has to be given to the individual. Okay, care plan is central to the quality of the service you offer. It depends critically listening to the individual and the family and staff who are closest to them. Okay, so whenever there is care plan, the individual has to be involved, the family have to be involved as well. Okay, and the staff as well. All right. Another point is giving social life through sociable activities, joint outings, and other activities to maximize loneliness and depression. So the individual has to be involved in joint activities like going out, going out to have some fun and having activities to prevent loneliness. Okay, all right. Any question? Any question? Okay, let's go to the next criteria. All right, the next criteria is discuss the mechanism for reporting poor practice in health and social care. That is 1.2. Discuss the mechanism for reporting poor practice in health and social care. That is the question. Let's see what I have here. All right. No, I think. No, let me continue with what I was, sorry. Let me continue with the first one. So there are, I told you that there are things that you have to know to enable you to answer your questions, okay? I think I sent off the qualified specification. If you didn't have it, yeah, or if you didn't receive, just leave your email for me and I will send it to you, okay? You leave your email in the chat box so that I will send the specification for you. It contains the questions and the specification, the criteria for each model, okay? Okay, so let's continue. Importance of providing dignified care. What are some of the importance of providing dignified care, please? Hello? All right, let me start with this. What is the meaning of and implementation of dignified care? What is dignified care? What does dignified care involves? What does dignified care involves, please? I want you to talk to me. Yes, who understand the meaning of dignified care? Nyano.
Yes.
Yeah,
Okay.
dignified care.
Dignified care. It means you show respect to the individual, and because the thing is, everyone has different beliefs. They're from different religion, different geological areas, and so you have to treat them differently depending on what they
Yes.
believe is respect. Everyone has a different definition for what is respect or what is dignity. So
Yeah.
you just try to make sure that you give the person respect according to his own belief.
Okay. So you have to ensure that the individual is treated with respect. Yeah. In a nutshell, everybody is treated in respect. Okay. Yeah.
Okay.
All right. Let's go on. I'm going to read what I have here. So, being treated with respect. Being treated as individual. So you have to treat the person as an individual as well. Treating as a person as individual means that you treat the person according to the needs, the wishes and preferences of the person. Okay. If there is an act, if maybe um it's lunchtime, for example, and then all the service users are in the dining room. Okay, there might be different food for each and everyone, for for everyone to make their choices. Okay, so they have they maybe Mrs. A and B. Mrs. A can go for maybe sandwich, yeah, tuna sandwich, and then Mrs. B can also go for um what is it, maybe chicken sandwich. Yeah, so they are treated individually, you understand. They are treated individually, though it's time for lunch. All of them, they all have lunch, but then you have to treat them individually. You have to give them what they will eat. Is that right? So you treat the service user according to his needs, wishes and preferences. All right. Another point is being involved in decision making and privacy. Yeah. So when you are in, if you involve the service user in decision making and then you give privacy, it's always a way. It's also a way of showing dignity to the individual. Those who can talk, yeah, you don't have to treat them anyhow when you are giving them personal care, yeah, or when you are treating them or giving them care, you have to involve them. Okay, like maybe you are washing Mrs. Brown. Mrs. Brown has different clothes in her wardrobe, so you can take maybe a green dress and you show Mrs. Brown. Mrs. Brown, will you like to wear this green dress? Or you take the a yellow flowery dress. Mrs. Brown, would you like to wear this beautiful yellow flowery dress? You are involving Mrs. Brown in decision as well, okay, to make her own decision. Another point is um one moment. Another point is treating people who need care as individuals and enabling them to maintain their maximum possible level of independence, choices, and control over their own lives. Okay, so choices is also another point of ensuring dignity. You give the individual choices as well. Okay, give them their own choice. Do not choose to them. Do not think that, oh, Mrs. White always um like to wear hats, so today she's going to wear hats after giving her bath. Okay, you have to ask her, Mrs. Brown, what will you like to wear your hat today? Give her opportunity to make choice. Okay. All right. Any question? Any question? Okay, let's
At
go
this
on.
time, no.
Okay. All right. There is also this that you have to do, how to promote independence. So all that I'm mentioning, yeah, it is points that will help you to answer the questions. Okay. So if you see, I don't know, those that I gave the specification, if you look at it, it has things that you have to know to help you to answer the questions. So that is what I've summarized, and then we are going through so that you get knowledge about how to put them together and then write your do your assignment. Is that right? Yeah. Okay, so
Yes.
the next point is how to promote independence. Can someone tell me how to promote independence? I think when I was talking, I mentioned it. I made mention of it. Yeah, how to promote
You just
independence.
mentioned that well, to promote independence, persons must be able to have their own mind, their own thought process.
Yes,
They must be able to
yes,
contribute willingly, voluntarily, and their contribution
yeah.
must be objectively received and not subjectively looked
Mm-hmm.
at. Just to be brief.
Okay. All right, all right. Thank you for your contribution. Any more? All right, let's continue. So I have here how to promote independence is to give individual the chance to do things themselves. Okay, I think I made mention of it that when you watch someone, if the person is able, okay, allow the person to maybe to, to dress up him or herself by him or herself. But if the person cannot do things by him or herself and depends solely on you, you have to do things for him or her. Is that right? But always give chances for the more able people who can do things for themselves, who can eat. If someone can eat, if Mrs. A can eat, do not go and then take food and say, Mrs. A, today I'm going to feed you, whether you like it or not. No. If you do that, it's Mrs. A wouldn't be happy. Okay. But always make sure that you involve Mrs. A and then give her the chance, yeah, to do things for them to her by herself. Assist them when needed. Okay. Make sure that you always assist them whenever there is any need for assistance. Ensure that you are there to assist, and then allow choices. Give them choices all the time. Involve them in decision making. I've mentioned that. Get them in community activities. Okay, they might be bored because they might be sitting at one place like a care home in their own houses. They don't have um they might be there for a long time, so it would be very good if you take them out for an activity. Yeah, if there's an activity being organized somewhere and then they would like to go, yeah, or maybe there is an outing that has been booked, you have to ensure that you you go, yeah, if there is an outing book or a community activity, you have to ensure that you involve them so that they wouldn't be bored. Sorry, that's what I mean. Yeah. And then encourage interaction with others if they can. Okay. So some of them are they, due to maybe their sicknesses or something, they wouldn't even like to talk or associate themselves. But you have to ensure that you engage them in conversation. Okay. You engage them in conversation, or just prompt them to maybe talk with the other service users when they are in group or something. Okay. All right. Another point is promoting anti-discriminatory practice. um Anti-discriminatory practice, can someone tell me, um give example of discriminatory practice? One moment, let me charge this One moment, let me try. My laptop was slow. Sorry, my battery. Okay. Yes. How can the service users, how can we promote anti-discriminatory practice in a care home? Yes. You all know what discrimination is. You all know, I'm sure. And how can you promote anti-discriminatory practice in a care home? Yes. Should I mention names? HP, I haven't heard you talk today. HP, give me an example of promoting anti-discriminatory practice. Can you hear me? Okay, Shireen, these people are they, where are they? Where are they? Or they've just logged in and doing another thing? Shreya, AL, can you give me an example of promoting anti-discriminatory practice in a care home?
By conducting equitable processes and procedures, allow persons to be treated fairly, irrespective of any social classifications such as race, ethnicity, such as whether they are poor, rich, class, and that kind of stuff. Allow persons
All
to
right.
whom even within the field of different job descriptions to participate fairly and equally within any work-related social events and that kind of stuff, so that seniors do not get an advantage over juniors and that kind of stuff. Those are some examples.
Oh, okay. Thank you. So the individual has to be treated fairly, equally, yeah, regardless of their background. Thank you. Nyano, Nyagno, can you come in?
Oh yeah, I'm here.
Yes. Can you give me an example of promoting anti-discriminatory practice?
Okay. Okay. So for example, a client that is on wheelchair, you try to ensure that he has his designated toilets for disabled people, so that he feels convenient to go to his own toilet um to ease himself, as against going to share a toilet that he clearly cannot use. So you're clearly discriminating because you're making him feel you're taking away his dignity, because now he has to struggle to do something that he can't even do. But if he has his own toilet, he can go to the toilet by himself and feel like he's independent.
All right. Thank you. Thank you for that point. Yeah. Yeah. So if maybe Mrs. Brown or Mrs. White or Mrs. Yes, Mrs. Brown. Let's take Mrs. Brown. If maybe Mrs. Brown uses wheelchair and there is no, and she wants to ease herself, yeah. Maybe the place that um maybe the care home. Sorry. How do I explain it? So there has to be accessibility of equipment so that every individual will benefit, okay, from the care given. Okay, like Mrs. Brown, if she wants to ease herself, there has to be a designated toilet specifically for people who use wheelchair. okay, so that she can use it whenever she wants to ease herself. Okay, all right. So I have here, avoid discrimination and treating everyone equally, fairly, regardless of their different backgrounds. Second one is avoid stereotyping. Hmm? Where you all know stereotyping. Do you know what stereotyping is? What is stereotyping? Stereotyping, yes. All right. Stereotyping is having preconceived ideas about certain people, group of people. Okay, having preconceived ideas, like people say all maybe women are bad drivers. That is a stereotypic sentence. It's a way of stereotyping. You are generalizing something that is not even true. Okay, you have an idea that women are bad drivers, so it means that every woman cannot drive like a man. No, you don't have to have that stereotype. Don't have that stereotype idea like, this group of people are like this, so I'm not going to even bother myself if I go there and she said, maybe, oh, I don't want this, I don't want that. This is how people of this group behave, so I'm not going to bother myself in what is it, trying to give the best of care to this group of people. No, don't have that stereotype idea. Don't have preconceived ideas about the people that you care for. Okay, ensure that you treat them equally. Is that right? All right. Empowering individual. Another point is empowering individual. So how can you empower the individual or the service user you take care of? How can you empower individual? Adeyinka. Adeyinka. Please, how can you empower individuals? Sorry? I can't hear you properly. I can't hear you properly. All right, maybe you have problem with your internet. All right, it's okay. So empowering.
Okay, empowerment. Hello, you're talking about empowerment. Can you hear me now?
Yes.
Can you hear me now?
I can hear you a bit. Yeah.
You can't hear me. Oh.
Talk.
What's going on there? But it's not. I'm not muted.
Yes.
Can you hear me
Talk.
still?
I can hear you now. At first, I wasn't hearing.
Okay, let's start. Empowerment. So we're talking about empowering an individual. I'm talking now. Okay, you hear me now? Good. When you talk about empowerment, okay, all right. In my empowerment is, you want to empower to cope for themselves. You create an avenue for them to obtain that to obtain capability and independence that will lead to independence. In terms of people that have a little bit of disability, maybe they have a little bit disability with part of their limbs, maybe their hand, right hand or left hand, or they can use the left hand well, but the right hand is not working very well. You want to empower them to be able to do things independently. By referring them to the certain professional in the team, like physiotherapy or physiotherapy.
Oh, you mean by referring them to physiotherapy?
By referring, physiotherapy, they can be able to gain back their independence. That is, you are giving them empowerment. You're empowering them to become independent, to do things for themselves. So
Okay.
that's what then again, if you're talking about other people, empowering people who have lack knowledge, or who have low, who has lack knowledge in some certain area, you understand, where they can actually learn more about certain skills. That is empowering them. You give them opportunity to study more, to learn more, so they became informed and aware of how to do things instead of teaching them all the time. You training, like giving them training,
All right. All right.
opportunity.
Yeah.
So that's how I
Okay.
understand empowering people.
All right. Thank you, Adi. So
No problem.
maybe people who cannot do things for themselves, like if the person, um, one of a person's hand is it's
If
not
you,
working. Let me put it
for
like that.
example, stroke patients, for example, if you
Yeah,
want to
stroke
empower stroke
patient.
patients, it's a long time process for them to be able to use their limbs again. So for you to
Yeah.
empower them, you refer them to physiotherapy. They kind of have
Mm-hmm.
many sections with them, and as time goes on with exercise, they can gain back their ability to use their limbs. That's then they can be able to be independent again. That's part of empowerment, I understand.
Okay, well done. All right. Thank you for your contribution.
You're
Yeah.
welcome.
So in a
Thank you.
nutshell, if somebody is disabled, if somebody cannot do a service individual or an individual or a service user cannot do things for him or herself due to a
Mm-hmm.
physically impaired, maybe the person is
Impairment.
challenged physically,
Yeah.
you have to
Mm-hmm.
maybe refer the person to a specialist, okay,
Yes.
to
Yeah.
have a session like physiotherapy, to
Mhm.
help, to have session with the person so that by doing that he or she will be able to gain, will be able to
Independence again.
use, will be able to gain independence, okay, in
Independence
doing
again. Yeah.
something with her hand, okay, his or her hand. Is that
Yeah.
right? All right. Thank you very much. Any
That's right.
contribution? Any more contribution about empowering the individual in a care home or empowering the individual you are taking care of? All
Are
right.
you
Let's
referring
move
back
on.
to me? Okay.
No, no. I'm
Okay.
talking to
From the
the whole
house.
group. The whole group.
Okay, ma'am. Okay. Okay.
Thank you for your contribution.
No problem.
All right. The others don't want to talk. HP, I haven't heard you. Shreya, Shreya, the whole day you haven't talked. Can you unmute yourself and tell us something? How can you empower the individual you're taking care of? Shreya, did you hear me? Did you hear the question? How can you empower the individual you are taking care of? All right, let's move on. So empowering individual. Yeah, thank you for your contribution, Andy. So I have here by giving the individual choices. Okay, if you give them choices, you are empowering them to be independent. Okay, so giving them choices to feel valued and know their self-worth. Okay, if maybe um, Mrs. Brown, Mrs. Brown, okay, maybe um, you've washed her and then you wanted to choose her own dress, okay, you don't give her the chance to choose her own dress. I placed this the wrong way. Oh. To all allowance, it was wrong. Okay. All right. You've watched Mrs. Brown and then you just choose her dress for her. You are not giving her the choice. Okay. Ensure that you ask her, oh, Mrs. Brown, which type of dress do you want? After washing her, which type of dress do you want? If she has several sandals or shoes or whatever, You ask her, Mrs. Brown, what type of shoe do you want? So you are giving her choices. So you have to ensure that all caregiving to the service users, you ensure that you give choices to the individuals concerning every care that you give to them. Okay. And then if you do that, how do they feel? If you give them choices, how do they feel? Hmm? They feel valued. Okay. If you give them choices, they feel valued. They will think that, oh, this person is not imposing anything on me. At least she's giving me the chance to choose things for myself. Okay, so they feel um, valued and self-worth. Another point is involve individual in their own care by promoting person-centered care. Okay, so person-centered care, as I've told you earlier on, it's care that involves around the individual. The individual becomes the center of the care. Okay, so it's all about the care. All care given to the individual is all about him. It's not about you. You understand? It's all about him or her. Okay, so you have to ensure that you abide by the wishes of the individual, the needs and the preferences. What he likes, what he or she likes, is what you have to give to him or to him or her. Okay, and also you have to ensure that you involve the person in decision making as well. Okay, all right. Okay, let's continue. All right. Another point is ensuring safety for individuals and staff. Okay, ensuring safety for the individuals and staff. So how can you ensure safety for the individual? How can you ensure safety for the individual you are caring for? Hello?
By using the appropriate PPE.
Yes. Okay. To
Um,
use the appropriate PPE, you are protecting yourself as well as the individual. Yeah? Okay.
following infection
Yes.
control policies.
Excellent.
Following manual handling policy as well.
Yes.
And the company's policy in
Yes.
general and procedures.
All right. Perfect. Thank you very much. So if you are for the health to ensure the safety of the individual, you have to ensure that um, the well-being, the health and safety, the well-being about the health about the individual. When you talk about the health, it involves the well-being, his eating or diet, yeah, eating habits, exercise, yeah, it's all about the health. Okay, and the safety, the safeness of the individual, like the environment, has to be safe. Has to be safe for the environment has to be safe for the individual. Okay, and moving and handling. If maybe Mrs. Brown cannot walk, whatever. If you have to transfer Mrs. Brown from wheelchair to bed, or from bed to wheelchair, and you have to use the manual handling. You have to use the hoist. Yeah, you can't use it without you having a training. Okay, so you have to ensure that you have a training before you can be able to do moving and handling. Transfer Mrs. Brown from the bed to the wheelchair, and then or from the wheelchair to the bed. Okay, you have to ensure that you have proper training of the voice, of how to use the voice before you can do that. Okay, all right. Another point is abiding by the legislation. Okay, so the legislation is made the legislation is made by the government, okay, and it has to be followed so that um, the best of care is given, okay, to the individual, or to ensure the safetyness of the individual. Yeah, like controlling of substances hazardous, the cash. Yeah, it's an cash is example of what is it, of legislation. So hazardous substances like maybe what is it, um, cleaning detergents, yeah, like Jeff and all that, they have to be stored in a safe place. Yeah, they have to be stored in a safe place so that the service user who has dementia wouldn't go and take it and drink, and maybe, oh, when maybe the where the things are kept, there is not even key to lock the place. So the individual who has dementia can just enter take one of the what is it, the detergent, cleaning detergent, and then start drinking it. Yeah, there has to things like that has to be kept in a very safe place, and then it has to be locked, and then the key has to be given to a designated person, okay, who will have access to the place all the time. Is that right? Okay. Policies and procedures also has to be followed. The policies and procedures are made at the workplace, okay, while the legislation is made by the government. So the policies and procedures, like health and safety, or like, yeah, how the environment is kept safe, yeah, it will be made by the maybe the manager or people at higher ranks. Yeah, they may have policies and procedures in place to ensure that the service users are safe all the time. Okay. Also, faulty equipment. Faulty equipment have to be reported. Maybe if you are using what is it? You are using a hoist, and you see that some part of it is broken. Ensure that you report it to the maintenance team, or you follow the procedure. You follow the procedure. Yeah, can you hear me? Can you hear me?
Yes, we can hear you.
Yeah.
I can hear you.
All right. So you follow the procedure at the workplace to report anything, to report it so that the hoist can be fixed. Okay. So anything, maybe if there is short of things, of equipment that has to be used, it has to be reported to the manager or whoever is in charge, so that some may be provided. Okay. Or when something is faulty, you have to report it so that it will be fixed. Okay, for the safety of the individual. All right. So you as a staff, how can your safety be ensured? I think you mentioned PPE. PPE. The use of, do you know the full meaning of PPE?
Personal protective equipment.
Personal protective equipment. Excellent. Yeah. Can you give me an example?
Hand
Example of
glove, nose
PPE.
mask,
Yeah. Yes. Like
apron.
yeah. Yeah. Like the apron. Yeah. Like the gloves. you have to ensure that whenever you are working, you use the PPE to protect yourself, okay? Use PPE all the time to protect yourself. All right. Yeah. All right. Another point is also training. Training. You have to ensure that you attend training whenever training is organized in maybe in your workplace. Do not dodge training, please. It's very important to have training so that you will update yourself. Okay, I think training is offered in a care home. Training offered, are they 3 months or something? Yeah, to help carers to update themselves. Okay, so ensure to gain knowledge about the changes, policies, and everything, to ensure that you always attend training. Okay, like manual handling, fire, health and safety training, what is it? Fire, something I've forgotten. Risk assessment and all those stuff. Ensure the first aid training. Ensure that any training has to be attended, okay, so that you gain knowledge and then you give the best of care to the service users. And then risk assessment. Risk assessment. Yes, can someone explain what risk assessment is? Risk assessment. Okay. So risk assessment is ensuring that the environment is safe. The environment that you are giving care, it's safe. Yeah. For instance, if you are hoisting Mrs. Brown from her wheelchair to the bed, you have to make sure that you get rid of anything that will be an obstruction for you to hoist her to her bed. Okay, maybe if there is chair or table closer to the bed, you have to make sure that you take the chair or table to the right place. Take it, because it's an obstruction. It can obstruct you to have an accident. Okay, if there is maybe paper on the floor, something that you can step on for you to trip or to have an accident, ensure that you get rid of all that things that can be an obstruction for you to hoist Mrs. Brown to her bed. Yeah? Okay. Any question? Also, the last point is to ensure confidentiality, data protection. Data protection, and then code of practice and legislation. Yeah, the code of practice is the same as the policies and procedures. Yeah, the policies and procedures at workplace. Okay, so confidentiality has to be ensured in the sense that no information about the service user has to go out. Information has to be given to the right personalities, like maybe the social worker, the GP, the chiropodist, the physiotherapy, and all people who will need it to maybe check something to provide to care for the individual. Okay, so it has to be given to the right people, the right professional, the right workers. You shouldn't go out. And then their data also has to be protected as well. Okay, all right. Right, let's go to 1.2. Discuss the mechanism for reporting poor practice in health and social care. 1.2. So, If there is poor practice in health and social care, what is the mechanism? What is the way of ensuring? What is the way? How do I put it? What is the mechanism to report poor practice in health and social care? What is the way to ensure that poor practice of health and social care is reported?
Whistleblowing policy.
Sorry? Yeah,
Follow the whistleblowing
whistleblowing.
policy or your company's policy.
Yeah. So there are policies in place to ensure that um, things are reported, okay? Or whistleblowing, you tell your manager or the right whoever is in charge, whatever happens, yeah, maybe example abuse, if a service user is being abused by a carer and you see it, please ensure that you report it, okay? Report it for the, what is it, for to save life, because you never know, next time it will be something else, okay? So whenever you see someone maybe pushing or hitting, yeah, like, oh, Mrs. Brown, sit down. You are always roaming about. Sit down. Or you push a service user, or you, whatever you do, any physical contact that you have with the service user, abuse or emotional abuse, or you neglect, if maybe the Mrs. Brown maybe accidentally um, fall on the floor. You've seen that Mrs. Brown is lying on the floor, and you saw it and you left it. You left Mrs. Brown without helping Mrs. Brown, yeah, to sit in his or her chair. If you don't have to do everything by yourself, you have to tell maybe your colleague, okay, so that you can use maybe the right equipment to lift her from the floor. Okay? So whenever there is an incident, whenever there is abuse, you have to ensure that you report it. You whistleblow for the betterment of the individual as well as yourself. Okay? All right. Can someone give me example of the mechanism for reporting poor practice in health and social care? All right, let's continue. So, Nyano, you mentioned whistleblowing, isn't it? And then,
Yes, I
yeah,
do.
yeah, whistleblowing. Okay, so you speak to your, well done, you speak to your manager or senior member of staff about your concern. Whenever there is a concern, do not keep it. Okay, ensure that you speak to the manager or the senior carer or the coordinator or whoever is in charge. Okay, read your employees' whistleblowing policy for information on what to do next. Okay, so you have to know, you have to read, what is it? Your workplace policies. Okay, policies and procedures. Yeah, to equip you, to enable you to get more information about what to do. When it comes to reporting an incident or whistleblowing. Another point is to report to CQC. Yeah, who is the CQC? Who is the CQC?
It's a regulatory body of health and social care.
Okay, excellent. So they are regulatory bodies of health and social care. Yeah, they are called Care Quality Commission. What they do is to ensure that the policies and procedures and everything concerning care is ensured. Okay, sometimes they inspect as well. They are inspectors as well, so they can go to a care home and inspect the care home. And if the care home doesn't meet their criteria, they have the power to shut down the premises. Okay, so you can also report to the CQC. All right. Understand the role of regulatory and professional bodies in relation to the delivery of high quality care. All right, so we finished with the 1.2. Yeah, let's go to 2.1. Let's go to 2.1. So the question is, understand the roles of regulatory and professional bodies in relation to the delivery of high quality care. Yeah. What do you understand by this question, please? Understand the roles of regulatory and professional bodies in relation to the delivery of high quality care. Yes. Nyano. The rest, you've decided not to talk. Nyano, do you have any idea?
Okay. So these are the bodies that regulate and inspect care providers to check for poor quality services. So their aim is to ensure that patients get the best quality. So they always come to inspect, and they give rate. Some of them give rating as well, and some of them have the capacity to penalize or arrest if you don't abide by their rules and regulations.
Okay. So example is when it comes to health and social care, narrow it down to health and social care. I just mentioned it. Example is the CQC. Yeah.
Yeah.
The CQC, if the care doesn't abide by their rules or they don't meet the expectation, they have the power to close down the care home. Yeah, like Ofsted in schools. Yeah, when they come for inspections, 1, 2, 3, and the company or the training provider, they don't meet expectation, they will just close down the training providers. So the management have to be on their toes to ensure that the quality of services is given, yeah, to avoid the closure of the whatever, the closure of the vicinity or the work. Yeah. AL, are you around? AL. All right, let's move on. Okay, so 2.1. Understand the roles of regulatory and professional bodies in relation to the delivery of high quality care. All right, the criteria to meet is here. Explain the roles of regulatory bodies that inspect health and social care provision. Yeah. All right, so I've mentioned the CQC, their roles concerning health and social care. Apart from CQC, can you give me another role? Do you have any other role in mind? All right, let's go on. Okay, so another professional, what is it? Yeah, another professional that have what's my question? How did I even ask the first one? Sorry. Let me drink some water. It seems I'm so tired today.
You asked the explain the role of regulatory bodies that inspect health and social care providers.
Hmm. Today I'm so tired, you know. I woke up very early. Yes, no, no. You said something, yeah. Can
Oh
you
yeah, you
repeat?
were asking me what you asked again. So you were saying,
Yeah,
explain, or you were asking, explain how health and social care providers protect individuals. Oh no, sorry. Explain the role of regulatory bodies that inspect health and social care provision.
excellent, excellent. Well done, well done.
Yeah.
All right. So we've made mention of CQC, yeah, and there
Yeah.
is NICE. Do you know what NICE what NIC is?
No.
Um, anyone does anyone have an idea what NICE is? All right, it is National Institutions for Health and Care Excellence. Yeah, National Institution for Health and Care Excellence. So the role they provide um, is to provide evidence-based guidance and advice for health, public health and social care practitioners. Okay, so they provide guidance and advice for public health and social care practitioners. Only by guidance and advice for what is it? Public health practitioners. They also provide information services for managers, commissioners, and practitioners in health and social care. Okay, that is the role of NICE. All right. Another point is professional body example NMC. The NMC, HCPC, etc., and how they work. Okay, so the NMC is the Nursing and Midwifery Council. Okay, the Nursing and Midwifery Council. Yeah, the Nursing and Midwifery Council are professional regulators for nursing and midwives in UK and nursing associates in England. Okay, all these groups, yeah, all these groups are parts of the regulatory bodies that inspect health and social care. Is that right?
Yes.
Okay. Ensuring safety for individual. Okay. All right. The NMC. Let me explain more for you. So the NMC, that is the National Midwifery Council. The roles they play, they regulate. That is the what is it? They promote high education and professional standards for nurses and midwives across UK and nursing associates. Okay, they also maintain and register professionals eligible to practice. If you've completed your course, health and social care, and you want to do your nurse and you finish, you have to be registered. You finish your course and then no, you want to be a practice nurse and then you finish your course. Okay, you have to be registered before you can start practicing. Yeah, by law, all health professions have to be registered before they can practice. The GP has to be registered, the doctor, the pharmacist, all those people, all those health practitioners, they have to be registered by law before they start practicing. If they don't, then it's against the law. They can be penalized for that. Okay, so the NMC, they ensure that they register practitioners. Okay, to ensure that they practice their profession. Another role is that they investigate concerns about nurses of professional practice. Yeah, any concerns about nurses. If a nurse maybe abuse a service user and the person is reported, it's their role to investigate the case. To investigate the case. Yeah, if the person has to face disciplinary committee or whatever, they have to decide. Yeah, so they investigate concerns about nurses of professional practices. Okay, then the HCPC. The HCPC is the Health and Care Professional Council. Health and Care Professional Council, HCPC. What they do is they protect the public by regulating 15 health and care professionals in the UK. Their work is to provide the public by regulating 15 different health care professionals in the UK. They set standards for professionals, education, and training and practice. This is what the HCPC do. They set standards for professionals, education, and training and practice. Okay. Another point is they approve programs which professionals must comply to register with. Yeah, they approve programs which professionals must register. All right. The third one is they keep a register of professionals known as registrants who meet their standards. Okay, there is a register that they keep and it's called registrant. They keep them. Okay, and they also take actions in professionals in register. They also take actions in professionals on our register. Okay, so they also take actions against professionals if their registration do not meet their standards. Okay, they take actions against professionals if their registration do not meet their standards. Yeah, so professionals they regulate should be registered first. Example of the healthcare professional that has to be registered are the arts therapists, the biochemical scientists, the clinical scientists, dietitians, hearing aid therapists, paramedics, physiotherapists, radiographers, speech and language therapists. They all have to register before they can practice their profession. Yeah? All right. Any question?
No, not at the moment.
Okay. Another point, the organization's rules in helping their employee the organization role in helping their employees meet standards, implementing code of practice, CPD, etc. Yeah, that is another point. So the CPD, where you know CPD. You know CPD. AL, CPD. Yeah, no CPD.
I don't know, but I know most trainings are CCPD, so I think it's a body that regulates trainings or something.
Yeah, it's a
I'm not really.
continual. Yeah, you are right. It's continual professional development. Yeah.
Okay.
It's an ongoing plan, learning and development process. Yeah. Like when you are, maybe you become a doctor, you have to have CPD, continuous professional development. You have to develop yourself by attending training seminars and meetings and all that, to help you in your practice. So it has to be ongoing. The same thing applies to care, nurses, midwives, and all those professionals. Okay, as far as you are a professional, you have to always um, study continuously. Yeah, professional is something, it's mandatory. You have new laws comes, policies, regulations, and all those that and all that thing, and all that. Yeah, things changes. So always you have to update yourself through the continuous professional development. Yeah. So it's an ongoing plan, learning and development process that enable all workers to expand and fulfill their potential. Okay. So when you attend the CPD, it helps you to expand um, and fulfill your potential as a carer or as a doctor or as a GP or as a nurse. Okay. It also contributes to workers based. It also contributes to workers based and personal development. Yeah, it helps the workers in their personal development. They develop themselves mentally. Mm. It also include any activity that workers do on a day-to-day basis, which increases their knowledge, experience, and understanding, and improves performance. Yeah, is that right?
Yes.
All right. Okay. We're moving to the next question. Any question so far? Let me take some water.
So I want to ask, do we need
Yeah.
to add, so for this part where we talk about the organizational role in helping the employers meet standard, where you're talking about CPD. So do we give other examples or just this ones?
Come again. Sorry.
So this column, this point where we have to talk about the
Yeah.
organizational rules in helping employers meet standard. Um, so do we give a lot of examples, or we should just
Yes.
focus on these examples and
You
expatiate on them?
exact. You can add it
Okay.
to your work. Yeah. To get
Yeah.
more example, as you said.
Okay.
Yeah. Because remember that you are writing 300, isn't it?
Yeah, 300.
Yeah, so you have to know bit by bit, bits of this, bit by bit. Then you combine all of them, and then it will help you to get your 300. Yeah.
Yeah.
Okay. Um. The next one is evaluate the role and responsibilities of the interpersonal team in delivering health and social care. That is the question. Yeah. So the criteria to meet is um, the first one is explain the roles and responsibilities of the interprofessional team in meeting care needs. Explain the roles and responsibilities of the interpersonal team in meeting care needs. Yeah. So some of the things that you have to know to help you are these. Yeah. So first of all, the um, interpersonal team. Yeah. What do you understand by interpersonal team? Yes. The interpersonal team They are, what is it? They are bodies, yeah, that work hand in hand in collaboration with professionals and organizations to meet the care needs of the individual. Yeah, they are bodies that work hand in hand.
Rosalie, I'm
Yeah,
sorry, I had a call that came in, so I missed out. I think you just started the professional and
interpersonal.
multidisciplinary team part, right?
Yeah, yeah.
Okay.
So,
So
I read a question that explained the roles and responsibilities of the interpersonal team in meeting care needs. That
okay.
is the criteria. 3.1. Yeah. So what you
Yeah.
have to know, we have to first of all know what the interpersonal team is. Yeah.
Okay.
So I asked a question, what interpersonal team is? Can you answer? Or do you have any idea what interpersonal team
I think
is?
um interpersonal team are just mainly a specific kind of field. So doctors in a hospital, doctors working together, but just mainly doctors, just mainly health practitioners. So, for example, I want to go book an appointment for my client. I talk to the doctor. That I can collaborate with the doctors. All the doctors are taking care of him. So the physiotherapist, the dentist, and maybe um, dermatologists, and I asked them if they can fix on the same day. So if it's just 1 hour appointment, can we have everything the same day? So if he just comes to the hospital just 1 day a week. So I think that is interpersonal. Why multidisciplinary, different disciplines. So the family, the carers and nurses, everybody that is involved in his care, whichever discipline. So we all come together to work together. I don't know if I'm correct.
Oh yeah, you are 100% correct. I think you can teach now.
Because I have been trying to answer the questions alone. I was just struggling, and
Oh
it's been a
really?
long time. Yeah, it took a very long time. I'm happy you're here. If I had you
Oh,
much earlier, I would have submitted my coursework all my by now.
I see. Well done. So it's all about collaboration between professionals, yeah, to work together to give the best of care to the individuals. Okay. So I have here as um, collaboration between other professionals and organizations to meet the care of the individual. Yeah. Um, what does the interpersonal collaboration practice? What does it? Yeah. Um. What is the meaning? I've explained the meaning. I want to add what I searched on online. Yeah. I Google it and then I have this explanation. Mm? The World Health Organization personal collaboration as multiple health workers from different professional background who provide comprehensive care. Yeah, they provide comprehensive care to the individuals. Yeah, yeah, this is it. Yeah. Should I go over? Should I go over what I said?
Yeah, I heard that. I heard what you said. You don't need.
Okay. The rest of you, I'm not hearing you. Why? You've logged in and doing your own stuff, isn't it? You have to be active, please. It has to be interactive. It has to be interactive. We are all learning, okay? Yeah, you may have an idea that you want to chip in, that you want to explain an explanation. You may have a question. So ensure that you always unmute yourself so that we can have the session interactively. Okay? Thank you. All right. I said that the World Health Organization defines interpersonal collaboration as multiple health workers from different professional backgrounds who provide comprehensive care services by working with their families, carers, communities to deliver the highest quality of care across setting. Yeah, I think you gave a very nice definition, Nyano. Yeah,
Oh, thank you.
yeah, about the interpersonal what is it? Um, yeah, about the question. Okay, so collaboration can occur between different professionals within one organization or increasingly between professionals who belong to a range of organizations, yeah, from the public, private, and third sectors. Yeah, it is not necessarily only required between health workers. It can be the police, it can be the social services, teachers, lawyers, yeah, private sectors, and all those, yeah. Charity workers, probation officers, etc., and also parts of the wide interprofessional team who involve in the support of the older people's needs. Is that right?
Yes.
Yeah?
Yeah.
Okay. Another one, I also had this source, another source. I Googled another source, and this is what I had. So definition is the general competence statement or explain. This is the definition. One moment. Yeah. So it is to use the general knowledge of one's roles of the other profession to appropriately assess and address the